All right, so just to say thank you to everybody. As a reminder, this is a USDA funded project called Megabytes Academy. Today's Lunch and Learn speaker is Andy Laudick. Did I say that correctly?
Correct, yeah.
All right, awesome. I first met Andy the hard way. He emailed me and I got an email basically talking about Crosse Encephalitis and how it has affected him and his family. Sometimes you get these emails when you're in medical entomology and you just choose to take the rest of the day off, and that's what I did. And it probably took me a few days to get back to him because it takes time to respond in a coherent sentence instead of just saying horrible things that you want to say. But anyway, the other kind of really awesome thing that Andy does is he is a GIS analyst in the field. So we have an industry representative here for today's talk. So you guys can go back and talk to your students about different things that he can hopefully talk to you about today, what you've learned. With that, I'm going to turn it over to you.
Hey, great.
And I think I'm ready to go. All right, thank you again. Yeah.
So happy Friday, everybody. I'm sure you guys had a long week, so it sounds like you have had a lot of great exposure. And so what I'm going to try to do today is kind of give you some background of my career and what I've done in GIS, but I'm going to kind of tailor it towards using GIS for vector-borne disease surveillance. So I think that's kind of what you guys are trying to focus on. And so I'll kind of give you some examples of, again, what I've done in my career, you know, give you a little bit more background of GIS if you don't have a good understanding of it. And then I'll just give you some examples of what some people are doing in the industry today, like solving real world problems with GIS technologies. And then I'll finish off with to give you a background of kind of how Crosse Encephalitis has affected our family. And I'll kind of give you the scenarios and kind of, you know, what happened from beginning and the process we kind of went through and trying to understanding and, you know, just being, unfortunately becoming aware of what Crosse Encephalitis is and what it's about. So, all right. So a little bit about me. So I'm from Greensburg, Indiana. I'm the southeastern part of the state. So we're kind of right between Indianapolis and Cincinnati. So I went to Greensburg High School, and then I went to Ball State University, which is in Muncie, Indiana. I originally started there, I had a kind of a passion for meteorology. At the time when I enrolled, they had a meteorology program, but then they discontinued it, so I would have had to transfer to Purdue and kind of start over again. What I found out in the geography department is they were starting this kind of a new technology called geographic information systems. So I kind of got into GIS kind of by default, but I do kind of have a love of kind of understanding spatial analytics and then mapping and, you know, studying maps. I've always kind of had a passion for, you know, creative maps and, you know, plotting things and, you know, understanding kind of what's in the environment and asking the questions that GIS does is kind of the what, where, and why of things. So I went there and I was kind of a teacher's aide. I did teach kind of some labs surrounding GIS. I was a lab manager within the department. And so luckily for me, when they started the program, so they did kind of have a special emphasis, which focused on GIS, remote sensing, and cartography. So I was kind of the first one that kind of went through the program and kind of graduated with that specialty. So from there, I went to a company called Wolpert. They were an engineering company. They're in Dayton, Ohio. And they kind of specialize in kind of the parcel mapping, architectural, land use planning, and that sort of thing. So that's kind of where I started out my career, and basically doing the digitizing of paper maps. So back then we had the big, you know, 80 inch digitizing table, and I took this little puck and then put a bunch of buttons and traced all the lines by hand. And then they also had, you know, the scanning technology wasn't quite there yet. But so all the parcel maps and a lot of things that are available today were kind of once hand done and hand digitized in. So luckily you guys don't have to go through some of that. There's still opportunities, I think, to, you know, input data, but I think we have different ways of inputting and scanning and adding the data in. So if you like data collection, you know, that's kind of the nice thing about doing what you're doing, your boots on the ground, you're kind of looking for locations of clusters of mosquitoes, finding out where they're at, where the larvicides are, where the eggs and everything, so you can kind of track and monitor and map those areas. So from Wolpert, I went to the Marion County Health Department, and then they're the kind of the county seat for Indianapolis, and they specialize in public and environmental health, and that's kind of really where I got my first introduction to actually mapping out mosquito sites. So they've got a pretty big mosquito control department within Marion County. So they have people that go actively spray and monitor mosquito sites around the county. So they had, gosh, I don't know how many paper maps, but several hundred paper maps. And again, we went through and we digitized all these areas where they went out and kind of identified clusters of standing water during the season. So from like maybe March, through September, they were actively monitoring these sites by hand. So they would kind of go out and they kind of did their own surveillance. They would have people that they'd call in and complain. They would take complaints, and that would go basically on a clipboard, and they would manually handwrite these down, and they would give the address to the mosquito techs, and they would go out and take their trucks and spray, or they would take the the sprays to kind of monitor and kind of spray up where the standing water is, to kind of combat the mosquito population, keep them from going into mosquitoes. So that was kind of some of the prevention and prevalence they did. But again, it was kind of very basic. So what we did, we kind of digitized the maps and we put them into our GIS. So we used, I'll explain a little bit more later, but we used the software called ArcGIS, or from a company called ESRI or Esri. And all that input information went in there. So we kind of, you kind of had to hand plot, hand draw all this information into the system. And at that point in time, it was still kind of, the technology was a little bit kind of crude. You didn't really have a whole lot of capabilities with online that you do today. So it was kind of siloed or centralized within the department. So it was kind of hard to, broadcast information other than on a website and show like a few numbers. And, that really didn't, draw a whole lot of interest. People was kind of looking at numbers of, areas they sprayed. So it's timing of this is, the technology is kind of advanced. It's outstanding of what you can do today. And we'll kind of show you few more examples of people that are using this at a pretty high level. And then just kind of finished out the career. I went to the city of Indianapolis, kind of did the same sort of thing, but kind of on a larger scale, looking at some of their infrastructures, bigger projects with kind of monitoring trash trucks, again, all kind of had a kind of a mapping background. So fortunately, City of Indianapolis and Cincinnati were kind of the two kind of early adopters of GIS technology. So it was kind of nice having that kind of in the area. So from there, I also, on the side, I also taught at ITT Technical Institute, which is kind of a technical college. And they had a program where they wanted to implement GIS into it. So I kind of help them, and I kind of organize and help develop curriculum around GIS and giving some examples of how to use the technology. And so I was kind of started up that for them. And then now currently at Hillrom, I'm doing a little bit different. I'm not really kind of doing a whole lot of the environmental mapping. I'm doing more of sales analytics and statistics. So I'm kind of stepped out of the environmental part of it, but I'm still doing the GIS and mapping within Hillrom. Okay, so I thought I'd just kind of throw some tidbits of information of, why would I even want to pick GIS as a career? So I just kind of listed a few bullet points for you to kind of consider and recognize, and hopefully it'll kind of ring a bell and, draw some interest to you. So today, GIS still continues to be a growing job market. If you look at anything that's in our world today, anything that's a point, line, or polygon, you can map and tie an attribute to. So the technology has endless capabilities and possibilities, and it's used all over the world and for many different applications. So just consider that as kind of as a source. There's really nothing that you cannot do using GIS as kind of a background. If you love maps like I do, that's kind of another thing that kind of drives. So you kind of have to follow your passion, and when you follow your passion, you'll accomplish great things. So just always remember that, whether it's GIS or not, just find something you're passionate about and go with it. And, you know, if GIS is that, then you got, I mean, there's great opportunities for you out there. If you like to go outside like I do, I like the, you know, enjoying the outdoors when it's nice in the summer. So you have, as you know, when you go out and do your collection and you're going out in the field, you know, you're outside. It's better than being in a little 4x4 cubicle all day. So I think that is a positive. Let's see. If you want more than just a career, you know, if you want a career or more than just a job, you know, you're not going in and just kind of putting your time in. You know, you're kind of with GIS, you're solving, you know, problems in the world, and I think that's kind of important. And also, it's kind of, I mean, it's kind of cool. You don't hear a lot about when everyone always asks me, you know, what did Andy go to college for? It's like, you know, for, you know, he went to, my mom could never explain it right. She'll, oh, he just makes maps. So, but you know, it's more than just making maps. So, you know, trying to explain the technology is kind of people open their eyes, and it's kind of, you know, the light bulb kind of goes on a little bit, but it's still kind of, sometimes it's kind of hard for understand kind of what GIS technology is for people. But again, it's something that's really cool. You can empower people or empower yourself to kind of go out and do things. And, you know, thanks to Becky for kind of reaching back out to me, you know, it's kind of, you know, we kind of maybe are empowering each other in this fight against the Crosse Encephalitis. And, you know, all mosquitoes really are vector-borne, you know, whether it's mosquitoes or ticks. So, you know, they all have a common theme of they carry deadly diseases and viruses. And, you know, we want to find a way to come back and, you know, help save lives and, you know, eliminate those risks. Again, if you're curious about the world, you know, again, GIS can be applied anywhere you go within our world. If you care about the environment, you know, there's a lot of environmental groups that use GIS mapping for, you know, environmental control. And if you're like me, and if you're curious about data and kind of wondering, you know, why this is there, it's kind of, you know, in regards to mosquitoes and La Crosse, you know, why is La Crosse heavily in, you know, parts of West Virginia and the Carolinas, and then not so much in some other counties. So no, you kind of look at the spatial, again, collect your data and analyze it and figure out, you know, the what, why, and where, and try to answer those questions. And, you know, I think it's something that's important. You know, it's something that, you know, we're all trying to solve, you know, problems, and we all have goals we want to do. And, you know, this is a great tool and technology to use for that. And lastly, I think, you know, you can make a difference, you know, with the outcomes. If we find out, you know, there's certain hotspots and there's reasons for it, you can map that, write your stories, and, you know, document it and explain why. And then, you know, you can explain to the world, you know, and find, you know, resources and solutions to problems. And again, that's what GIS is really good for. Okay, so what I did, I kind of, since we're kind of focusing on schools using GIS, I did find kind of a little video. I think it's like a couple minutes long. Hopefully the sound comes through okay, but it's kind of, it's highlighting a school with the STEM program in Maui, Hawaii, where students are actually using GIS within the school. So we'll give this a shot.
Yeah, you might have to turn off your microphone. It might do a dual thing real quick.
I think it's fun because it's not only technical, it's also about the community.
Using the latest GIS online app, students and teachers across Hawaii are working on solving community issues.
The really cool thing about working with ArcGIS online and the projects that the students develop is it gives them an opportunity to, one, collaborate with our partners through Women in Technology, through our STEMworks class, and the connections we can make for them to collect data and to also affect change.
Within their STEMworks classes, students research, analyze, and present data to investigate real-world problems using GIS technology.
Basically, our STEMwork project is to solve the overpopulation of the axis deer.
Deer right now are an invasive species, and we feel that it's a problem because they cause a lot of damage. And like recently, they did a survey on deer damage, and it added up to $1 million.
With my research with the shark track maps that I've made was that they have a seasonal tracking that in the summer is actually in the south of all shark attacks and the winter is more in the north.
My sexual predator proximity to children map is about mapping the proximity of sexual predators to schools and facilities where children may tend to hang out.
These types of collaborative, informative, and important STEM projects can influence policies, people's opinions, and decisions. The development of the online version has made creating projects easier, and you can immediately have success with the technology.
I think it's because it's a visual aid into what you're trying to explain and show to the community. Like, especially with the program ESR I created, because it's such an easy program to work with.
These connections are not just for the students' benefit as far as what they learn, but also they can then turn around and share the information and the maps that they've created in our GIS Online to make a difference in our community.
Learning the software and applying it to important issues allows the students to demonstrate 21st century skills.
You know, we always talk about relevance and we always talk about workplace readiness, but I think this is a perfect example where learning these tools, students can right away go out in the workforce or in an internship.
As the online community of ArcGIS grows with new and innovative projects, so does its potential.
We see in the future these kinds of things happening. It can really expand people's horizons as far as seeing what is going on, not just in our little community here on Maui or in one area, but just anywhere in the world. The implications, are unlimited.
The Hawaii ESRI license is available to every public, private, and charter school through a partnership with MEDB's Women in Technology, the Hawaii Department of Education, and ESRI.
Okay, so hopefully that came through okay. I'm not sure about the volume quality, but hopefully it came through halfway decent.
It was
Yes.
good. Yeah, we got it. Yeah.
Okay, cool. So I think that was a pretty cool example. You know, that's kind of, again, someone in Hawaii, high school students using GIS technology to solve problems. So the educators, you know, it's kind of, you know, you've got that in your graphs to kind of take that and implement it to your students. And I think that's great and outstanding that we have, you know, you as educators and then other students kind of taking this on and, you know, finding the passion to do this. So I applaud you for all your efforts in doing this. And I look forward to hearing about more of your successes with this. So I thought I would just kind of highlight some GIS software just to kind of give you some ideas what's out there. I picked these select few because these are ones that are kind of most commonly used if you're doing for vector-borne disease and surveillance. So I got a couple different tables here. I just kind of listed out. I've not used all of these. I have used the QGIS, and the reason I mentioned that one because it's free. So it's available out there. If, you know, if there's not funding or if you can't get grants to kind of help pay for software, there is some free software out there, and that's one that I would recommend for a free platform. The one that I've kind of used ever since college was ESRI and the ArcGIS software. And they have some applications that are kind of tailored specifically for this vector-borne disease monitoring surveillance. And they have programs available. And I mean, they're really generous with providing software and license for schools. So I think you just kind of have to contact ESRI and, you know, find out what's available. And then there's also grants, and they saw with the Maui school, they had some funding from other areas. So the tools and resources out there are available for your taking. Okay, so what I'd like to do next is with a theme thing. So mapping vector-borne diseases. I kind of go through and give you some examples of some tools that that are commonly used out there. And then, so you guys are already doing some of this, so you guys are probably doing a lot of this already. So we'll just kind of go through and highlight some of these things. So the challenges we have with mapping, you know, mosquitoes and ticks is, you know, really they're found everywhere, but different mosquitoes can carry different diseases. So we have, you know, kind of the Aedes that carry the chickamauga, dengue, Zika, yellow fever, the Culex, And then, you know, with lacrosse, we're looking at the Aedes triceratops, you know, so it's kind of, you know, why do these mosquitoes carry these certain diseases? You know, where are they at? You know, can they carry other diseases? So those are kind of some of the questions of the whys that, you know, that kind of, you know, are spinning in my head. So I'm not an entomologist, but, you know, we'll look for Becky and, you know, her group and all the people in the entomology people that, you know, kind of study this daily. And then you collecting the information in the field, gathering this, you know, can kind of help answer the whys. So it's, I mean, what you're doing is very important. You know, it's not something that's kind of, you go out and just, you know, go out and, you know, in your day. But what you're doing is, you know, you're collecting real world data, and you're, you know, hopefully, you know, going to change a lot of outcomes with this. So the reason we do this is we want to protect people's health and residents that live there. So, you know, by performing surveillance, you know, you're actively monitoring the situation instead of, you know, doing nothing. So I think it's very important. A lot of times, you know, the public can be very active and vocal at times, whether it's for or against. So, you know, one of the things I found out with this is, you know, the people that, you know, complain about the mosquitoes a bit, you know, they want the county to come out and spray and do something. You also have the other people that, you know, they're really, really environmentally conscious that, you know, think that the spraying is bad, you know, as long as, you know, the chemicals and the treatment they're doing is, you know, environmental friendly, environmental safe, you know, that's a good thing. But, you know, there's also two sides of the story that, you know, that I've come across when talking about this. So it's just something to be aware of. And then with the way we can communicate and the way technology has made, you know, things almost instantly available, you know, whether it's Twitter or Facebook or whatever else. I mean, you know, things, you know, what they say, go viral instantly. So, you know, if there's somebody reported a huge outbreak of, you know, West Nile in, you know, a certain area in the county, you know, it gets recognized quite a bit. So it's important to continue monitor and add surveillance to this, so, you know, we can make the public aware. So what we want to do is we want to combat the vector-borne diseases, and the way we do that is through mapping applications, and then, you know, your involvement, and then getting, you know, feedback from the citizens. You know, the citizens are going to make, you know, this, you know, really, you know, if it's going to shed some light and become, you know, a big topic, you know, the citizens and people complaining about this always kind of, you know, get noticed. You know, the more people complain about it, the more recognition it gets. So what you do is, you know, you go out in the field, what you're doing today, you collect the data, you map the data, but then what you want to do is, then we have to combat it. So, you know, if you find the tools and the resources to, you know, control the spreading of the larvae into adult mosquitoes. And that's, you know, that's what we want to try to do. So with the technology, again, with the online capabilities, you know, there's online requests, you know, so a lot of counties you can submit an online form, whether it's, you know, on your computer or laptop or, you know, your mobile device. You have the capability to, you know, report mosquitoes and incidents. And then what happens is, you know, that call comes in, and then, you know, whether it's based on an address or a lat long coordinate or whatever, you know, that request gets mapped and pinpointed on the map to show the location. And then from there, you can dispatch, or, you know, you can report, you know, send people out to those areas to investigate and, you know, do the reporting and analysis of from the calls. So the tools are, you know, great. So we have iPads, iPhones, devices now that we can instantly collect, and we also have a georeference associated with them. You know, before we kind of had to have a map, and then we had to have a handheld GPS unit map that data, and then we kind of had to download it and bring it back in. So the tools and the technology is you know, is advanced dramatically from even the past 10 to 20 years. So we have the tools and resources to do it. We just have to take advantage of it now going forward. So again, with health departments, you know, this is something that's usually pretty high on their radar. You know, so what it does, you know, I mean, it causes health concerns. So, again, you will see on the news, during the, the season with West Nile virus, someone gets it, it kind of gets some attention. Or, when there's a fatality, that's kind of when, things kind of, so whether it's from a tick or a mosquito, when deaths occur, that does get recognized. So if you have the tools in place to kind of, again, help monitor and, report and show that you're kind of doing the things in the background, all that every little thing helps. Okay, so this next clip is kind of using, I think it's in Tampa, Florida. So this is a county that's actively monitoring and doing surveillance in Florida, and it kind of gives some good examples of what they're doing, and to kind of show you all the ins and outs and what they're doing.
Well, all new at 5:30, mosquitoes are on the move again, and so is the threat of the Zika virus. Good evening, everyone. I'm Laura Harris.
And I'm Paul LaGrone. This time, there's actually a new weapon in the fight against the disease-carrying insects. I spent the day today inside the new mosquito war room. From the killing fields,
That's the number one killer in the world.
to the war room, former enlisted Marine Donnie Hayes is directing the battle of the bloodsuckers.
So basically, we have maps now that are able to tell a story of what's going on within Hillsborough County dealing with mosquitoes.
And now Hillsborough County Mosquito Control is using a brand new weapon, mapping software, plotting out precisely where the insect enemy is. It seems like a very miniature version of something you'd see at CENTCOM, in the sense of taking analytical information and using it to direct, your plan of attack. I mean, do you sometimes feel like you're at war with an insect?
We definitely are. We definitely are. And we do call this a central command for us here in Hillsborough County Mosquito Control.
The advantage? Real-time data on mosquito hot zones.
Every time a citizen calls into Hillsborough County Mosquito Control, we're able to dot on the map of where that call is coming from.
All of it cataloged and then mapped, revealing where they need to send in the spray trucks to strike. How does this technology help you fight the potential threat of Zika?
Definitely enabling us to make operational decisions sooner. To be able to put it on a map and see it, we can make operational decisions instantly versus waiting 24, 48 hours.
And just look at how the technology's evolved over the last 15 years. They've gone from using a clipboard in the field to this bulky thing, looks like an old cell phone, to the iPad. And the iPad in the field is linked up to Central Command, meaning the agents have all this info at their fingertips when they're out there on the Zika front lines. And the new approach seems to be working. In its first month of use, Mosquito Control has plotted out more than 18 mosquito larvae sites.
Well, all new at 5:30.
Okay, so again, that's a pretty cool example, and that was just, I think that was done like last year. So really current counties out there doing this, and again, that's just kind of highlighting one. There's several out here, and what I did, I kind of listed out just kind of as a resource to kind of reference if you want to, all these different areas that are kind of actively doing GIS implementation successfully with using the software. Again, most of it's online. So again, what's critical about this or important is when if they're out in the field, they plot the point, as they said, it instantly gets transferred to, again, their mosquito control department, and it's mapped out instantly instead of waiting, sometimes 4, 8, 12 to 24 hours before you get that information plotted, mapped, and analyzed. So timeliness is of essence, and, again, we have the technology and the tools to do all that. So with that, that's kind of high level, and then we kind of just focused on mosquitoes and vector-borne disease and illness. But again, GIS can take your career anywhere you want to go. So it depends on what you want to do, what your interests are, and you can follow that and use GIS Career to take advantage of that. So again, GIS is going to answer the what, the where, and the whys. And if you have interest in that, then GIS has a lot of opportunities for you to do so. Okay, so I guess we'll hold all questions until the end. What I'll do now is I'll kind of go and share a presentation I put together that kind of focuses on the Crosse Encephalitis and how it affected us with our daughter, and I'll kind of go through the timeline of events and kind of what happened to kind of show you kind of what Crosse Encephalitis is about. All right, so what happened is, so just a little introduction. So Leah, she was born October 29th in 2008, and she's the little one that was affected by Crosse Encephalitis. She, on August 10th in 2013, she was only 4 years old, and that's when her final day here on Earth was, because of Crosse Encephalitis. This is confirmed virus. Her samples were sent to the CDC, and actually I've become in contact with the person that kind of analyzed her samples, Amy Lambert, and she's been gracious enough to kind of help work with me and, you know, do things to spread efforts to make Crosse more aware. But a lot of times you'll hear, you know, if you'll hear about mosquito viruses, you know, whether they've got it or not, or what the death occurred, you know, a lot of times people don't even, you know, really consider it being a confirmed case, because a lot of people just don't really understand that mosquitoes can kill, unfortunately, but they do. So we always just kind of have to reference that it was a confirmed case of Crosse. So Leah's our 5th child. We have 7 total in our crew. So she was sandwiched in between a couple boys. So what I could do is kind of explain kind of a timeline and kind of where we live. So again, we live in Greensburg, Indiana, in between Indianapolis and Cincinnati. And at the time, you know, we didn't live in the wooded area. We lived in town in a residential community. So I know we talk about the Aedes triceratops. They're a daytime biter, and they're kind of known as a tree hole mosquito. We always had trees, but I mean, there were a lot of squirrels and chipmunks around in our area. So, you know, whether the host, you know, where the host was, where it came from, you know, it could have come from, you know, those sources. But, you know, it's not really, Crosse is not confined to, you know, woodland areas. So mosquitoes can, you know, I guess, get in the trunk of a car, and you can transport them, you know, a couple hours away, you know, open the trunk, and, you know, they kind of fly out. So, and, you know, if you think about, you know, the Asian tiger mosquito, you know, it came from Asia on, you know, the cargo ships, and they were transported over here by those means. So they do have a way of, you know, getting from point A to point B unexpectedly sometimes. So, so again, this is kind of our neighborhood. You know, it wasn't a heavily wooded area. So what I'll do now is kind of go through and kind of give you a timeline of what happened, and kind of let you understand of, you know, what are kind of the symptoms, things to look for. So, you know, we were actively, you know, outside, but we know we were constantly outside. So, you know, going back to the events, you know, this is a picture taken on July 24th for a bike ride. This is our county fair, July 11th. And so we did get one good last picture. This was taken on August 4th. This was her mom's birthday. And this was the day before kind of the symptoms started happening with Leah. So on Monday, August the 5th, Leah complained basically of a bad headache. So we kind of used Tylenol and Motrin at the time, and we didn't really think, you know, too much about it. But on Tuesday and Wednesday, she was complaining that, and it was really more severe. She was kind of complaining that her head really hurt and was pounding. It wasn't a, you know, common just headache or cold. So on Wednesday, we ended up taking her to the ER because it was pretty severe. So when we took her into the ER, they did do some blood work. It showed that she had some slightly elevated white blood count, and then they did end up admitting her for observation. So then Thursday came around. They continued to monitor white blood count. It did remain slightly elevated. So the doctor went back and forth, and they were able to really decipher if she had a viral or bacterial infection. So they were still kind of grasping at straws. They didn't really understand what was going on. You know, then Leah continued to she really slept most of the time. And then when she would wake up, she was constantly complaining about her head hurt. So those are the main symptoms going into it. Then Friday, August 9th, she became more or less responsive and lethargic. So then we had to transport her up to Indianapolis to Peyton Manning Pediatric Hospital in Indianapolis. And then en route in the ambulance, this is kind of when her active seizures started on the way up to the hospital. So they did give her some medication to help with the seizures. They did some CT scans. They did a spinal tap and was admitted to the PICU at this time. Again, tests were non-conclusive, so they still weren't really to understand, exactly what was going on. So what they did ask, they did ask kind of where we were at. They thought it might have been Rocky Mountain spotted fever, or there's another virus that's kind of with the same symptoms she had. They kind of treated for that. Again, they started a few medications. They were kind of, the crazy thing about it is they were just kind of unsure, even though the timing, of this was August, even in Peyton Manning Children's Hospital, they didn't really have a good sense of awareness, this could be a mosquito-related illness and virus at the time. So again, Friday evening, they kind of had to sedate her and continue to sleep. And they monitor conditions through the night. And then, so Saturday, the August 10th, that's when I got the call from the main doctor at the PICU to discuss Leah's condition. And about 6 o'clock or 6:45 in the morning, this is when all of her kind of brain activity stopped. So she was, I guess, essentially characterized with no brain activity. She was not, her activity and stuff was not going to be, her outcome was not going to be very good, obviously. So, so we called the family in, and we kind of had the last few hours, with Leah. And then about 9:45 on August 10th, that's kind of when Leah took her last breath because of the Crosse Encephalitis. So what happened is, so in late September, our pediatrician called us back and said it was a confirmed case that she died from mosquito with California. Well, I guess the serogroup, I guess, is California serogroup, but La Crosse was the virus that she had. Just some side notes. Again, what we also found out at the time is, our older daughter, who was 15, said she also had a bad headache and flu-like symptoms. So I don't know if possibly it was the same mosquito or if it was a different mosquito, but again, she kind of had some similar symptoms and she didn't tell us about it at the time because obviously what we were going through and everything, but we think that she possibly may have been bitten by a mosquito too, but because she was a little bit older, she was able to fight it off since Leah was only 4. When we talked to a lot of doctors about, what happens, they commonly talk about, the blood-brain barrier is not always developed yet. And basically this is just kind of it's a heavy-duty virus that she got, and it was just hard for her to be able to fight it. So what this has, done for us is, it's given us a mission and a goal to kind of help prevent this from happening to others. And then, I reached out again to Dr. Becky, the CDC and other people that are in entomology to kind of, I just keep asking questions. And, that's kind of what you do with anything, if you're wanting to try to figure out and solve something, just keep asking questions. And that's what I keep doing. And then, you may not get answers right away, but eventually, you will get some answers. So just kind of real quick, my title, Leah's Hope, is kind of what, our goal is, would be possibly eliminate all vector-borne illness in children and adults. So in human cases, so these are some older statistics, but, about 27 states have reported La Crosse encephalitis. The greatest risk are for children that are 16 years old and younger. So this, again, it's a summertime virus. Obviously, it has a 2 to 7 day incubation period. The common symptoms are, headache, fever, nausea, which is, common with a lot of things. So it'd be nice to find a way to, if someone comes to the ER, look at the timing and, a way to kind of do some blood tests that are conclusive right at that point in time to diagnose it. But the problem is, there's no cure for it. So that's the unfortunate thing. So, you talk about vaccines and other things, vaccines are kind of hard to come by. They take too much time to do and not always effective. And, they have stuff in there that's always not good sometimes. So, there's work to be done with, with Crosse and, West Nile, Zika, all the viruses out there. The problem with lacrosse is, we're the 1% out there, unfortunately. So there's not a high fatality rate. And, we see comments out there, trying to look for answers and try to solve this. And, people will say, well, it's only 1% of the population, who cares? We've run into that quite a few times. So, 1% is still 1%, if it's, with someone you care about, your love, whether it's your child or a relative or a friend or someone, anytime someone dies from something, it has an effect on someone. So, sometimes, statistics, we run a lot with statistics, sometimes, the higher statistics obviously get the greater attention, but, even though it's 1%, it's still a statistic, and, it's something that I hope to kind of make, 0% one day. And also a lot of problems with lacrosse is it's not always reported, it's misdiagnosed, or, a lot of people are able to overcome it, so they kind of attribute to flu-like symptoms, and they eventually, are able to overcome it without any side effects. So these are some statistics of lacrosse, over the years. Obviously Tennessee, the Carolinas, Virginia are some of the kind of the heavier areas of lacrosse. Not a lot of deaths, unfortunately, fortunately, but unfortunately for us, we were again kind of the 1% in this case. So, we kind of asked, why are mosquitoes still a threat to humans today? I didn't have time to kind of add this in, but, I've even reached out to there's Bill and Melinda Gates. They have a foundation that they're trying to eradicate malaria from the world. Malaria is kind of the #1 killer out there that, doesn't always receive a lot of attention, but malaria has killed more people than anything in the world over the history of the world. So malaria is still out there. They're still fighting that, and people are still dying that in, in Africa and other areas of the world, Central America. So it's still common and out there. The small children, kind of why are the smaller children, elderly, at risk, just because there are not many deaths reported doesn't mean we should wait for a major outbreak. So what you're doing, actively doing this, again, the surveillance, monitoring, mapping, all plays an important role. So it's not an easy task. There's not an easy solution, but again, we want to just keep trying. And it'd be nice to go outside. Unfortunately for us, every time we go outside in the summer, it's kind of like, are we at risk? Are there a bunch of mosquitoes out there? Does this one have a virus? It's it's something that's kind of affected our lives, because we're always kind of on high alert, unfortunately, even during the summer months. So this is just kind of something I added in there. So this is just kind of a quote. It's still true today. So there are millions of children that are one mosquito bite away from death, regardless of, what mosquito type it is, what virus, that still looms out there today. Zika, obviously, we had a pretty critical global health crisis, a couple of years ago. Again, that kind of the squeaky wheel got the grease in for that. And, they made a lot of efforts and a lot of attention got brought to it. So funding, when things like this happen, they do get funding for these certain things. So, it'd be nice to set up there are surveillances out there, so it's growing in popularity, so people are doing it more, so that's good. So, maybe one day we'll have some global network of surveillance that we can use. And, so I say get all the smart people in the room to figure this out, and, that's kind of where I look at you guys. You guys are all the smart people in the rooms, you know, all the students, educators, entomologists, you know, everyone that's kind of in this fight together. You know, you guys are all the smart people, and together, you know, I think we can figure something out. So again, we don't want, you know, Leah just to be another statistic. Again, we just want to keep going and fighting the fight, doing what we can to do this. And again, I thank you, Dr. Becky, for inviting me to come along and share my stories with, you know, GIS Career, and you know, kind of the outcome we faced. Even though it's not a fun one to share, you know, the message is still important to do, and that's what my goal was. So what I'd like to do is share this kind of last video. Hopefully, again, the sound is good, but this kind of is a telling story of, you know, what's out there and how it affects people's lives. The little girl that died in this video was, I think she died from Eastern equine. She was out east, but her story is really similar to what happened with Leah. And there's a couple other gentlemen that kind of talk about what happened with them.
What's the magic word, Aaron?
Kimberly King interview, take one.
Hardly anybody knows that I have a problem if they didn't know me beforehand. But I look normal. I act normal. But I'm not normal.
The neurologists say that I'm probably about as good as I'll ever get, which means I'll always walk with a cane. If I fall down, I have to have somebody help get me up. I won't ever be strong enough to lift my kids.
I have 3 children, and I have 4 children, 3 that are alive and 1 that's dead. Adriana was amazing. She could light up any room. She was a smile bug. She was just learning to ride her bike. She was super excited about entering kindergarten and being able to ride the yellow bus. On the 5th day at the hospital, she was pronounced brain dead. And then she died in my arms at 10:39. And that was it. A mosquito killed my child in less than 6 days.
My son and I were playing out in the front yard doing some work. We started getting eaten up by mosquitoes. Probably about 3 days later, I started feeling like I had a bad case of the flu, and that's kind of when the nightmare started. I can very clearly remember when the doctor came in, because I couldn't talk. All I could do was listen. She told me I had West Nile virus. I had no idea that it existed. I had no idea that it could do what it did to a human being. And I certainly had no anticipation that I would spend the next year of my life in a bed and learning how to redo things that my children had recently learned how to do.
When I was admitted to the hospital in Bloomington, my wife Roberta called my brother and said, "You want to see him before he dies, you better get on the next plane and get here." My legs were paralyzed, my arms were paralyzed. To stand up was excruciatingly painful. It almost kill you, it was so painful. I was out of work for 7 months. When I went back to work, I could see patients for 1 hour, and then I had to go back home, go back to bed. I wasn't sure I was going to survive. I wasn't sure I was going to be able to go back to work at all. So the fact that I'm able to go back to work, even if I can't do everything I used to be able to do, is really a blessing.
Purchased once. I lived in the hospital from August 29th, 2009 to February 28th, 2010. I did another 6 months of rehab, relearning how to walk and swallow and speak.
People that get sick tend to have permanent, lifelong problems because of the illness.
Only one of my lungs works, so I breathe at about 50% capacity. I have nerve damage throughout my extremities, which means I can't run. I can barely climb stairs.
it's the sort of thing you never think will happen to you. I was perfectly healthy and it happened to me.
It's non-discriminatory, and once you get it, you've got it, and there's nothing out there that stops what it does to you.
Mosquitoes aren't mere annoyances anymore. They have devastating effects, physically, emotionally, financially. Like for us, 6 days in the hospital, it was $180,000 out of pocket.
The economic impact of one person getting West Nile and going through what I went through is pretty tremendous. And it's such a simple thing to take a few steps to avoid.
We eliminate any breeding grounds. Mosquitoes only need 1/8 of an inch of water to breed in.
2 drops of water in a bottle cap or an overturned flower pot or something in the yard, that's where they breed. All you can do is protect yourself.
Burying a child is the hardest thing in the world. How wonderful she would have been. What a great big sister she could have been. She was riding in a hearse to her final resting place rather than being on the big yellow school bus for her first day of school. She never got to experience life. I have a very strong faith that God only takes the best. He only gives you what you can handle. And he gave me a purpose in life.
People really don't realize the potential problem for infectious diseases like West Nile until it comes home to them.
You're either lucky like me and you get to live like this for the rest of your life, or you're unlucky and you're dead.
Just because it doesn't happen to everybody doesn't mean it's not a big deal. Just because it hasn't happened to you yet doesn't mean it's not going to happen to you next year.
My name is Sean Lemoyne. I'm a business trial attorney.
My name's Kimberly King. I live in Pembroke, Massachusetts.
I'm Dr. Don Reed. I'm a colorectal surgeon in Medical City, Dallas.
My story's real. The other victim stories, they're real. Is it fearful? Yes, but it's real.
We have to be vigilant. We have to take public health measures to try to prevent this disease from occurring.
It's important for the public to play their part too and take personal responsibility. It needs to be done.
Okay, so yeah, so those are kind of the, the full spectrum of GIS, looking at mosquitoes, vector-borne disease and illness, and then kind of some of the outcomes that have come full circle with this. So I hope it was informative. Again, GIS is something that you're looking forward to do. I encourage you to do it. And then just remember the fight you're doing today with monitoring, collecting mosquitoes, doing the research analysis is fantastic, and I applaud you for all your efforts. And again, thank you, Dr. Becky, for heading this up and being a leader in what you're doing, and appreciate everything you're doing.
Thank you, Andy. I'm right here just to give you a heads up. Sorry. That was a lot. I'm going to take a minute to not say anything unless anybody has any questions for Andy.